So excellent news, no community-acquired cases in Queensland in the last 24 hours. So we still have those 2 clusters and we've still got to be careful for the next 14 days. So thank you for everyone for coping with these masks. They're very uncomfortable and hopefully we'll be able to get rid of them soon. But thank you, it makes an enormous difference. And before I go into the details of this most recent case, I just want to say to people who've been involved in these 2 clusters, they've done everything absolutely wonderfully. So I always say, let's find the first case in a cluster, not the 40th. And that will stop us then having hundreds of cases. So it's been an enormously successful process in terms of people coming forward and sharing information with us. People are so prepared to share their very close contact details with us they've been, and that must be so hard for individuals. So our new case is another nurse, and can I say we are so lucky that we have nurses and doctors and healthcare workers who are prepared to look after people with COVID. Today, across the world, more than 17,000 healthcare workers have died from COVID. So I thank every single one of our healthcare workers in Queensland who have been out there on the front line looking after positive COVID cases. So this is yet another nurse who has unfortunately, through doing nothing wrong, has contracted the infection from a gentleman who's clearly a super spreader. It's not his fault either. He was the gentleman that came from Europe and was admitted and transmitted the infection to a doctor. Now he has also transmitted it to a nurse. So that's the process that's happened. And then the nurse, again, through absolutely no fault of her own, has then gone home and transmitted it to her partner, who is one of that group that we know who live in that North Brisbane area and are a close social network. So then it's spread within that network. And then we had the gentleman come forward just out of the blue and get tested. So due to all of those people doing what they did so effectively, we found that cluster and we've got it under control. So the nurse didn't develop any symptoms at all, and we managed to pick her up through being a contact, of course, and we've done serology, and it's the serology that's come back positive, not a PCR test. So we will never get virus that we can do a genome sequence on, but she's treated the same patient that the doctor who got infected treated. So it's clear that that's how she's got it, and then she's transmitted it to her partner, and it's then moved in that circle of friends and colleagues, which is what we know COVID does, which is why I really do want to continue that limitation on household gatherings to 30 people, because we know that's where COVID spreads. It's in those close areas. The other place, of course, is in hospitality, because people spend a lot of time there. They sit at tables and they're close together. So that's why we need to keep those arrangements in place for another 14 days. And again, thank you for that record testing. That is what will help us all, because we will find the next case and then we can get on to it quickly. I mean, you just think how few people we've had in these 2 clusters. We, Queensland Health, myself, everyone and the whole community has learnt what to do. Think back to the Brisbane Youth Detention Cluster. In the end, we got 50 out of that. So think how much quicker we are at reacting now. And that's thank you to all people across Queensland being cautious, being alert and coming forward and getting tested. Thank you.